Hey class, we are going to do a fetal pig dissection today. So go ahead and get out your kit that contains the fetal pig. It's also going to contain a fantastic poster, your tray, some twine, and some rubber bands. So go ahead and take that out, and you can use the blue mat to protect your work environment. Please make sure to put on your personal safety equipment, such as gloves, and you also want to use your apron and goggles. We're going to need scissors today, probe, scalpel, and either the twine that came with your kit or the rubber bands. The bag with your fetal pig probably contained lots of liquid. So you're going to open it up underneath this sink so that you can have some place for that to drain. So here's my pig. Let's go ahead and get ourselves oriented. We have our head region. This is going to be the anterior. We have where the tail is. This is going to be our posterior. The back will be dorsal. And on the front where the umbilical cord is going to be ventral. One of the first things we can do is see if we have a boy or a girl. We look at the ventral surface. We can palpate either a scrotum or, if it is a female, we have the genital papilla. Right now, we have a little girl. We can see the genital papilla. If it was a boy, you'd have a scrotum, and you would see the urogenital opening near the umbilical cord. In order to make getting into the thoracic and abdominal cavities easier, what we do is we use twine or your rubber bands to position the fetal pig. Tie our front legs with our twine as tight as we can. Take that under your tray and then tie that to the other front limb. We will have to tighten this again later. And we're going to do the same thing to the back two legs. Now we have our fetal pig positioned and stable so that we can start making our cuts to look into the mouth and the neck region. So you're going to take your scalpel and we are going to start to cut along the side of the mouth because we want to gain entry into the oral cavity. I'm going to do that on both sides. As I do it, I'm going to continue to widen the mouth. I want it to open to a point where we can see some of the structures of the oral cavity. We can see the tongue, hard palate, soft palate, And if you've opened the mouth far enough, there's going to be a little leaf-like flap right at the very back of the mouth. That flap is called the epiglottis, and the opening in that is the glottis. The epiglottis is going to lead us to the larynx. We call this as our elastic cartilage, little flap that's going to close over the opening to the trachea whenever you swallow. Now we're going to start to make our cuts in the neck. The goal here is to expose the thymus gland, the larynx, trachea, and thyroid gland. So take your scissors and very gently, you're going to start to cut through the neck. Keep your cuts shallow so you don't destroy the structures underneath. Now I'm going to start to make a cut on the anterior side of the front limbs. Once you've made your cut, get out your blunt probe. That is your best friend when it comes to dissections. Gradually expose the structures in the neck. The thymus gland should be sitting over top of the trachea. See some of that here. So make sure you see that first. After you've seen the thymus, we can start cutting deeper. So at this point, we have removed enough muscle to have a good view of the thymus gland sitting on top of the trachea. As we continue to dissect in here with our probe, we're going deeper and deeper. And right below that, you're going to find a red structure. This red structure sitting below the thymus, that is our thyroid gland. Once you've seen that, we can start dissecting out the trachea and larynx. So take your probe and just continue to dissect through the tissue in the neck. You can feel the larynx, the voice box. So take your time and just keep moving tissue around. You're going to have to remove that thyroid gland now. At this point, we have dissected enough now that we have a really good view of the larynx and the trachea.